5 Good Things. I'm Janae Sharp, and I'm introducing us today. I'm the founder of the Sharp Index, and I'm thrilled to sit down with Megan Antonelli, my friend, and the founder of HealthIMPACT Live to talk about 5 good things.
Hi, Janae. Hi, everyone. It's great to be here. It's a wonderful time to be talking about 5 good things because, well, there's not that much good happening as far as I can see. The election has cast a bit of a shadow over my optimism and my feminism and women's health in general, but we're going to do this anyway. And we're going to look for the bright spots, the good things. And there are, as there always are, even though it might take us a little bit longer to cut through some of the headlines, good things in healthcare this month. And I just got back from the American Heart Association meeting, which was such a good thing. And I love to do it every year. The health tech competition, we had 5 amazing finalists who are all working in, saving lives and cardiovascular heart health. The winner was a group called Powerful Medical with a incredible ability to assess using AI-powered tools, EKGs, whether they're paper or electronic, and to be able to, assess and predict heart failure very, very early on. We had star judges, which included Star Jones this year,
Really?
which was super fun. And she gave the awards with Nancy Brown, who is the head, of course, of the American Heart Association. So that was super cool. And then Hecka Health, who actually attended our meeting in New York in June.
Oh, we love them.
Yeah, them, the value-based care play in cardiovascular heart health. So really great competitors. And they also had Flow Medical, which was exciting. They were a finalist. They are a device that clears pulmonary embolisms, which of course is near and dear to my heart because that's
my sister had one.
Yeah, my mother had that. She did not have the tool.
My sister tried to drive herself home from the hospital when she was having one.
Oh gosh, that's no good.
Yeah.
But overall, just a great event. They get so many, and I've said it so many times that I'm starting to feel like a broken record, but I just love going to it so much because the physicians are so excited about healthcare and technology. Right. They're so excited about new tech and innovation, and they all sit in the pavilion and watch Pat Dunn's amazing sessions. He put together 3 days of full programming. We had a lot of the past winners. It was super fun. So it's just great. And to see these physicians who are cardiovascular surgeons, and we just have in our head, we have that they're ivory tower, but they're not. And they're excited about technology and they're innovative and there's a diverse group of them. And it's nice to see. And I think the American Heart Association is a very, in itself, diverse group with lots of, lots of things going on. And of course, I'm working with the Center for Health Technology and Innovation on the competition, but there is also another good thing.
Let's talk the other thing. Yeah, I also heart disease is the leading cause of death for women. And I've been able to go to some events here in Charlotte with Casey Kalpin from Premier Inc. They invited some of the people here and just to watch some of that work and how much people care about it. And the energy is great.
Yes. The Red for Women initiative is great. And of course, they've just brought in a couple months ago now, I guess, Lisa Sunan,
one of your favorites.
Yes, a digital health and the founder of the Sweetener Mentor Program for Women. So a huge women's health proponent. And she's over there helping.
Our second good thing is Lisa. It's the $75 million venture capital fund, specifically for women's cardiovascular and brain health function. And there's a big disparity in how much funding happens for women versus men. So I think we should always bring attention to it. We need more people who are just going to share that. There are already 55 million committed. The Go Red for Women Fund aims to bridge critical gaps in healthcare and talk about women's unique challenges. So the initiative really works And
Yeah.
it complements the social impact thing, and it complements the technology that is being innovated there.
Yeah. I mean, cardiac arrest and heart attacks was so long a sort of a men's disease, and so much focus was there. And certainly, I mean, if you've ever tried to wear one of these devices that you're supposed to, track how things are going, that they're not designed for anyone who doesn't have a completely flat chest. So
plus widower maker just doesn't sound as good.
No, right. No.
It doesn't roll off the tongue quite the same way.
Actually, like one of the companies that I think maybe it was the first year was Bloomer Tech, which was actually it's basically a bra that you can wear post surgery or post an incident, so that you can measure, and designed for women and by women. So I'm excited to see the companies and innovators that they they find. There's no one better to do it than Lisa. So we're excited to see what comes from that. And along the same funding thing, there were a couple articles around women's health
from Forbes.
And kind of the just where money is going, and that there's a lot of attention. I feel like we talked about the movie, the menopause movie, in our last segment, but of course that went public, and has gotten a lot of press, and there's lots of money going into femtech and women's health.
Right. It's great to know that people are realizing that women exist. Also,
we're not going to vote for them, but we exist.
And I've really wanted to share things like Emmy. We've interviewed them before. They don't share your data. Think about that, ladies. Deloitte released a report about how this was covered in the article from Forbes, talking about the market and how people are realizing that this exists and you can make money there. We should invest there. And the femtech market is expected to hit $100 billion by 2032, according to that report. And some of that momentum, it's been started and supported by First Lady Jill Biden and Melinda French Gates. We hope that will be a bipartisan issue, that women, all of us can care about women. I hope,
and take care of women's health. Sure.
Yes,
it would be good.
And people did ask. The article does ask that, what's going to happen next, and those outlooks, those matter. And I think a lot of women that I know, they're asking, what's going to happen next for women, and what's going to happen to funding.
And then there was another one too. The Pivotal open call by Pivotal had a Action for Women's Health. I think they have a $250 million global call, looking for applicants for funding. So, we'll put the link in the chat, and you can, explore that too. So lots of opportunities. Let's get to it. Let's focus on women's health and making sure, progress doesn't stop there.
Right. I feel like women can really move things forward, and it's nice to see some of those things. They also released the Peterson Health Technology Institute purchasing report, so we can see, are people just talking about it, or are people spending their money? Right. And to sort of transition to another thing we like to talk about a lot, which is evidence for digital health, and digital health working. And another fabulous woman in health IT, which is Meg Barron, who's over there at the Peterson Health Institute. And they are, released a couple controversial studies. There's definitely people didn't like it. My
people don't like to necessarily
Peterson Health, the overlap there. It was honestly interesting on LinkedIn. Thank you both for making LinkedIn interesting for me that day. There's a good thing. The discussions, though, they are important, because we wonder why, if it's so logical and it's so good, why are people not doing it? So I was glad that was brought up.
Right.
So they have another one that talks about.
I think to go in a little bit there, I think what's interesting is, and we've talked about this today, we talk about it with a lot of our guests around, digital health point solutions, and how well can they work when they work in isolation and you evaluate them, and the payers and employers are coming at it from a different place than, what an individual might be looking at from a value paradigm. And so, we have to take all of those studies and we have to take all of it to sort of look at it, again, holistically to see what does really work and how we're going to connect it all. Because I think so much of it doesn't quite work here and it's not working there is because we're looking at it, in the vacuum that it's being tested in. And that's just not how healthcare is. It's not how the human body works. And not only is it just, our bodies, but the environments that we're in. And there's so much impacting that. But I do think that the work that they're doing is shining a light on how to, validate and assess these technologies. And that's what's really, that's what's important. And then figuring out, of course, how to work with health plans and employers and health systems to figure out, what is it that they're measuring and what do they care about?
Right.
So it's good work, Meg Barron. Good work, PHTI. And there are a few more on evidence, right?
Digital Dime, the evidence.
Correct. Another great
library.
Organization. Another great woman, Jennifer Goldstein, the executive director of Digital Medicine Society, also an Olympic swimmer. She is amazing. And they are releasing finally, I was waiting for some organization to do this, but they've put together kind of a database and a seal to really evaluate trustworthy digital health solutions. So they've got a group of experts and they're doing that to get some transparency through the digital health market, which is great. So and both Meg Barron and Jen Goldsack are going to be at HealthIMPACT in January.
I love that. We're going to love having them. And Elevance Health also did. Is that related to this?
It for sure is. I mean, Elevance being a payer, but they've just launched a social needs investment lab around the community health workers and, kind of bringing those interventions and medical tailored meals. And they have an evidence assessment library. So it, again, the focus and effort coming from all different parts of the organization or all stakeholders within healthcare to, assess evidence and bring those digital health tools making an impact to market.
I love that. Speaking of women, there's another woman and a bipartisan issue that I happen to care a lot about. The Lorna Breen Act is up for refunding and there are tools, and Stephanie Simmons is the chief medical officer there, and she's a physician. And she's shared some great news, which is that 34 licensure boards have taken out stigmatizing questions for physicians in licensure. So
for our audience members who might not understand the significance of that, Janae, why don't you tell us a little bit more about that?
That's a great question. So there are different levels of licensure. Physicians are leveled at the state level, and then a lot of times their identities and they're credentialed at the individual level, the healthcare system level. Sometimes those questions included questions about your entire health history, like your entire mental health history. And they asked some pretty stigmatizing questions. Like if you had ever had a baby and had like postpartum depression, like your entire health history would be included there. And, the American Medical Association advised against it and other groups as well. And it was really something that a lot of people came together on to say, this isn't something that should be here. Not only, I think it was like even the attorneys agreed because they're like, we don't want to get sued for violating the ADA. So states are coming out to say, we won't ask those questions on their medical licensure exams. And I like that. Mm-hmm. That's great. Yeah, people love it.
It is good.
And really with some of that funding, like it's up for support today, just this year, to refund the act, which improves research. So those are two different things. Like one, we're making some progress here. People are agreeing that, yeah, we will remove the stigmatizing questions. We're going to make it better. And then people are also saying, we also should invest more and know more to about protecting our healthcare workers and about protecting mental health. So,
right, because it's not just about, the individual so much as is what it says about our stigma with mental health. Right? Why should that be a disqualifying or qualifying question on this type of thing? And it getting rid of that is moving the needle and in the right direction and getting to a place where it's less stigmatizing, for healthcare workers to manage their mental health appropriately, which is
and we want to protect them and we want to protect patients. So I think that's great news. Like we can share stuff about how to get involved with that. I think through a lot of the frustration people have, like all the Facebook fights with everybody, it's nice that people care about mental health. People can agree this is something we need to work on. And that's a nice place to be, to realize that there are still people who want to do this work and who are going to do great work.
Right.
So that's my good thing.
Right. Well, and that's a good reminder, I think, in the context of this and having talked to Dr. Matthews today and Abby Levy about their good things as we look at what good things are coming. And it may seem a bit grim. While I liked Dr. Oz for many years until
I was on the Oz show. You knew I wasn't going to be able to resist. You brought it up and it's your fault. Like, okay,
so
I
why
was on a
today
show
were you on the Dr. Oz show?
I got to talk about John dying. It was interesting. There was like some miscommunication. Like, so the story got a little bit changed, but I will tell you something. I got to share the story about John dying, and he's so charismatic, and his staff had been with him for 9 years. I don't necessarily have, similar political views, but that man is pretty charismatic. And I hope that people are able to care, and there's a lot of good work.
I think, Gita Nayar's, sort of, I think she posted about it a little bit. I mean, charisma is leadership, and it is a good leadership quality, and it can help in a lot of ways and bring attention to good things, and good work being done. And there's certainly no shortage of work that needs to be done in Medicare and Medicaid. Whether it's the only qualifier you need, that is debatable, but it is.
I mean, that's not on the good things.
No, right. So we're staying with the good things, but to that end, there is a lot of work to still be done. And I think, one of the good things that came through the election and the brief election series that we had was the group of women online, Missy Krasner and that group, sort of women.
You were in it too.
Women for Kamala, and they've just released a notice saying that they're going to continue to organize. Lori McGraw and that group will continue to do things, and that's a good thing because things need to be done. Yes. And there's no shortage of that, and that it gives us purpose, as Dr. Matthews from City Block Health said. There's no shortage of things to be done, and we can organize and continue to focus. So
yes, so we're excited for good things. We hope you better share our podcast, everybody who's listening, and message us. Tell us what your good thing is, and if you're frustrated, that's also something you can message us.
And my last good thing, which of course
we have another one
we're excited about, is we have confirmed our keynotes for Health Impact in January.
This is a good thing. It's a big deal.
And I had the pleasure of meeting Chelsea Clinton at an AHA meeting and again at Health. And she is, a fantastic public health advocate and investor through her Metrodora Ventures. So she will be interviewing 3 of her founders on stage at Health Impact in January. So we are super excited about that among the, number of amazing speakers and keynotes that we have coming. So,
and what's the nonprofit that's involved? Because they're a big deal too.
Oh my God. Also a good thing. We are partnered with Road Recovery, who is a nonprofit founded by Jean Bowen based out of New York, but national programs for mental health teens in recovery and mental health programs where they use music to, help these kids through tough times. And they have an incredible story around when they were in the pandemic, because they were based in outpatient facilities and they had to take the whole thing virtual. And so we have a few charity opportunities available and things in the works, and we may even be getting a surprise concert and guest happening. So I can't speak to that, but it might happen. So maybe that will be our good thing in December.
I think there's just such great work, and it's so nice to see how people are using their celebrity or using their platform to do good things for kids with addiction and kids who have had mental health challenges. I'm thrilled to be part of the event in January, and everybody better come. And, I don't know, learn about the sponsorship things, ask Megan, she knows everything. And I'm thrilled to see our friends there. So that is a great thing to close out on, a good thing.
It is. And everybody enjoy your Thanksgiving. Relish in the gratitude and the turkey.
Yes, I love turkey. So thank you so much. And this has been another month of good things.